Dr. Susie Schofield from the CME and the University of Dundee has joined me this afternoon. Susie, thanks very much for coming along and for your time. Why have you come back to AMEE this year?
Oh, I think AMEE is just the most amazing thing to come to every year. I mean, you'll remember the first one I went to was with yourself in Malaga, and it's just so exciting, and there's the networking opportunities, there's workshops, there's always new things to look at, to take back to the centre.
Yeah, and of course it gets better every year. This time I hear there are something like 3,500 people from 102 different countries.
Wow.
So it is a really great place. So you've been meeting people from the courses which you've been involved in the CME in Dundee over the years. How long have you been there? Tell us about the courses and your role there.
Oh, well, the courses, I joined 10 years ago, and even by then, you know, it's the most established Masters in Medical Education, started by Professor Harden 40 years ago. And obviously there's been a lot of changes in 40 years to the delivery of distance learning. Recently I've been taking us online. I've moved us to a cohorted program where people can really take the benefit of being online and forming communities of learners. People are meeting people digitally, virtually, may never meet them, or may actually meet them here at AMEE and say, oh, I did the course with you, which is just an amazing thing.
Which it is lovely, isn't it? And people do recognise you if they've been in a video conference with you in the past. Yeah. Well, are there any other benefits of being in AMEE?
I think just really making those connections is hugely beneficial. I think also that feeling that our role as medical educators is valued, taking that back to our institutions, that self-efficacy. One of my PhD students, Asan Sethi, looked very much at what the benefits, for example, of doing an online course were. And the self-efficacy, having the language, being able to discuss, being able to present at places like AMEE, all hugely beneficial.
Yeah, that's very important. That is interesting because it resonates with my own thoughts about the AMEE course which AMEE run. AMEE is the Essential Skills in Medical Education, and that's applicable to doctors or healthcare professionals who are teaching some of the time, but also to students. And as you're saying, it gives them the language or the ability to talk appropriately and intelligently in an informed way about aspects of medical education.
And the understanding. I think, you know, the understanding for students about assessment, principles of assessment. I think, oh, why didn't someone take me through some of these principles when I did, you know, before I did my school exams? You have so much clearer understanding of what it's all about. And of course with AMEE, we've got this really exciting link with CME now, where students who have completed an AMEE course can apply for recognised prior learning and then go on to our own course, the certificate, to build up a very stepped up certificate, diploma, masters, maybe then on to PhD or professional doctorate.
And that is very wonderful. We've got the AMEE courses advertised here this time, and running some face-to-face, although they're normally online. But I think the University of Dundee, along with 5 or 6 other universities, now recognise the AMEE courses contributing in the way that you said. So what courses do you run from the centre?
We run a huge number. We have over 1,000 students at the moment online. A lot of them doing the certificate to develop their own teaching skills, and then those that are interested in a leadership role move on to the diploma, the research level of the masters, and we've built it up in that way that people can sort of, you know, step off and then step on again at a later time in their career. We do have a small face-to-face program as well, which is very, very bright, vibrant, very international, and we have masterclasses for our distance learners to join for 3 days with our top masters full-time at the university.
So it's quite accessible to a variety of people and variety of situations, isn't it?
Because we recognise the flexibility that's needed. Some people may never be able to get to Dundee, but they still need that rich interaction with others that we can offer them. Others may be able to come full-time, others not full-time but may get, for example, some study leave, come over to sunny Dundee where I know you live yourself, John. We have lots of sun, don't we?
We did this year, But I've been hearing about another course which is on top, as it were, of the certificate and the diploma, the masters and the PhD in medical education, a professional doctorate. Can you tell us what that is?
Yes, we're just launching a new interdisciplinary professional doctorate in January 2019. Very exciting. And there the students, again, it's recognising this need of professionals very often to stay in their professional work, but to have something to enhance their own lifelong learning. And so here they will come to Dundee for 2 single weeks, January and June each year, but the rest of the first 2 years are taught. But they'll be online. So I'm using all the skills that we have developed at Dundee through 40 years of distance learning, bringing that to make this really, really exciting programme where working across disciplines, we know we're not in a single discipline world now. We know that the solutions that we need for today's health problems and tomorrow's for society's problems don't come from siloed professions now. It comes from that meeting of minds from different professions. So,
it's interesting you say that. I've been speaking to people who are here on the surgical track, which has been run in the AMEE course for the first time, and they were talking about the role of team learning and how members who are going to work together in a clinical team do well to be trained together, and the importance of that method of training to help people along. So that's interesting to hear about. How do you value CMD? I think you mentioned earlier about the personal expertise and the kudos which comes from having a qualification. But what do you think CMD does, continuing professional development in medical education, does for the benefit of patients?
I think it alters how clinicians feel about teaching. It opens up new ideas to them that they can use in a way that might make the healthcare more efficient, which will impact patients. Or, for example, we do a lot on communication skills, as you say, with the surgeons, with the anaesthetists, the amount of teamwork, CPD that goes on. So I think we can see evidence of the benefit for the patients, even though that's much more difficult to measure because it's progressively further on from where we're teaching. Also involving patients in teaching is very, very interesting.
And that's quite a topic, both in this conference and I know being planned in the future, the role of the patient as an educator. So a brand new field, really.
Yes, and again, what a fantastic time to come to AMEE to learn about something that maybe you've never even thought about in your own institution. Again, take that language home with you. Get those contacts, show the evidence, show what's happening in other places.
And I should have mentioned earlier that AMEE conference here is really a multi-professional event. It's not just people training from medicine or dentistry, but other healthcare professions and nursing staff are also represented here.
And thinking back again to CME, and you're mentioning about the surgeons, of course we have an increasing number of specialist certificates now, so looking at those different professions, what are the needs of each one?
I think the requirement to have some qualification or experience in medical education is much more required, isn't it now, by the government and by the awarding bodies?
Certainly in the UK we have the GMC training, the trainers with the medical trainers.
So it's going to be an exciting conference for you again this year.
I can't wait. This is just the beginning.
Susie. And I'm sure we'll both learn a lot as usual. Thank you very much, Susie Schofield, for taking some time to have a chat with us about the role of CME